In our elder care segment this morning, we're talking about something that many of us experience as we age, joint pain. We hear it's a part of aging, but it really doesn't have to be. Dr. Arbaje is here with Tiffany Bryant and Rosemary. Thanks so much for coming in.
Thanks for having us here today.
Now, I'm shocked. You shocked me right before we came back on. You're 79?
Yes, I am.
Wow.
Isn't that amazing? She looks fabulous.
Yeah, Tiffany, is it the exercise?
Definitely, it definitely is. And that's what we're here to talk about, is that exercise can happen even if you have joint pain, because joint pain can be improved by exercise. So people think, oh, if it hurts, I shouldn't really use it. But if you use it carefully, that's what makes a big difference. So we're hoping we can show some exercises that people can do in their own homes so that they can try to prevent these pains.
I want to get to that in just a second.
Yeah.
The joint pain issue, is that something that just happens as we age, or is it something that we can actually fix?
Well, so some part of aging does include losing some of the cartilage in our bones and in our joints, and that can cause some joint pain. But really, the joint pains occur when we don't strengthen the muscles around the joint and when we don't have good alignment and posture. And so exercise can really help prevent or delay the onset of joint pain, not just because it strengthens the muscles, but also because of our alignment is much better, and it strengthens our core, which keeps us from falling and injuring our joints. So it's something that older adults don't have to face as much as they think that they do.
Is it ever a precursor to something else?
Joint pains?
Yes.
Well, it certainly can be. You should certainly talk to your healthcare provider if the joint pain is not really related to something you've just done, if it's just kind of coming up. It could be gout, it could be other kinds of arthritis that we need to think about. Or it could be a fracture that's not clear. So you should always check with your healthcare provider first before starting one of these regimens, but definitely check that out.
Okay, so they go to the healthcare provider, then they go see Tiffany, a personal trainer.
Yes.
Do you deal with this a lot?
Yeah, actually, I do a lot. I have a lot of different people with high blood pressure, high cholesterol, Parkinson's disease, post-polio syndrome, so I get all different people coming in.
But they can still exercise?
Yes.
That's the point.
Okay, so Rosemary, I know you don't have joint pain. It's probably because you're so fit and you exercise so much. But can you guys show some of the things that you do to fix joint pain?
Definitely.
Okay.
One of the first most key points is balance. So I'm going to show a heel to toe straight line. Okay.
This is very important. So let's go ahead, Rosemary.
So put your right. Yep, there you go. Heel to toe.
Now you see this is a simple exercise, but it's very difficult. And so Rosemary is very advanced in that she's able to do this without a lot of trouble. The reason balance is so important, now we think of exercise as lifting weights and doing cardio, but really for an older person, balance is very important to prevent falls. So what she just did is very key.
Okay, so you start with something like that. What else?
Next is core strengthening, which is very good. A lot of older people have lower back pain, so making sure that the core is strong is definitely key. So we're going to do a chair stand, so go ahead, sit on the edge of your seat, hands across your chest, lightly lean back for me, and stand up. Extend your arms out in front of you, and then stand back down nice and slow.
Now look what she's doing. She's not using her arms to stand up, which many older people do, and that's a sign of weakness in the hip area, and that can lead to falls. So the fact that she's doing it without her arms is fabulous, and that would be the goal for an older person, is to be able to do that without using their arms over time.
Would you say, doctor, a lot of this needs to be done before you end up in pain, maybe doing preventative things now so you don't end up in pain later?
This is one of the most important exercises that you can do to try to prevent falls and hip fractures, and which can lead to further pain. So absolutely. If you have pain, though, you can still do this. It just needs to be more moderately done.
You are certainly an inspiration because you get out there and get it done. Do you have any advice for people as we all get older? What would you say?
Well, I do feel that everyone should keep active in their, and it keeps you young, keeps you feeling well, and it's good for everything.
All right. Where should somebody begin if they're saying, oh, my elbow's starting to hurt, my knee's starting to hurt? Where do they begin?
So a couple things. Still talk to the healthcare provider first. Make sure there's nothing medical going on that needs to be ruled out. And then be careful with medications. I wanted to make sure we mention that because many people take over-the-counter medications for pain, and you want to avoid things like ibuprofen and naproxen because those can cause more problems. So talk to the doctor first, and then head on over and work with someone like Tiffany or another trainer who can help work with you around your joint injuries.
All right. Well, thank you so much, all three of you, for coming in.
Thank you.
Justin.